Now, the disease that caused by excessive alcohol intake start with alcoholic fatty liver, which the patient or the consumer of the alcohol patient will not feel anything, just can be found by an incidental ultrasound findings show that there are fat in the liver. And later on, the liver function test might become abnormal, such as the elevation of the liver enzymes. And usually at this early stage, the patient will not experience any symptoms. After a long period of alcohol drinking, then the patient will develop possible hepatitis of significant degree, which we call alcoholic hepatitis, and that can cause jaundice, fever, and abnormal liver enzymes. And at this stage, if the patient reduce the alcohol or stop alcohol, the liver can be reversible, the inflammation will subside, and the liver cells or the liver itself can turn back to normal or near normal. But in the long term, if the patient continue to drink excessively for over periods of time, maybe 10-20 years, there will be more inflammation and chronic inflammation, and which will lead to fibrosis of the liver. That means scarring of the liver. And finally, with excessive scars in the liver became cirrhotic. And after the liver became cirrhosis, in the beginning, patient may not have obvious symptoms in some cases, but finally, after a long period of alcoholic-induced cirrhosis, then the liver will decompensate, and that it means that the patient will have persistent jaundice, will have edema, swelling, and change in the level of consciousness, which we call sometimes that it is due to liver failure. But however, at this stage, if the patient can stop drinking alcohol, the cirrhosis can improve. Even in the patient who are waiting for liver transplantation, it can reverse. I mean the liver function can get better, and they may be delisted from the liver transplantation program. So, alcohol is one of a very reversible cause of liver disease, which the patient can help themselves by stop drinking.